Hello, I'm Srijoy Mahapatra. I'm a cardiac electrophysiologist and the Vice President for Medical and Scientific Affairs at St. Jude Medical. I'd like to talk to you today about an upcoming paper in the Mayo Clinic Proceedings called Clinical Predictors of Risk for Atrial Fibrillation, Implications for Diagnosis and Monitoring. AF is a fast heart rhythm that is associated with a higher risk of stroke, death, and heart failure. 46.1 million people have atrial fibrillation, but unfortunately, more than half those patients are not diagnosed. Undiagnosed AFib in particular is dangerous because it can lead to strokes since those patients are not protected by anticoagulants. Recent data suggests that long-term monitoring with, say, an implantable loop monitor can diagnose many patients with AFib. However, they are not cost-effective in the general population. Thus, we sought to create a risk score using 16 previously published papers to try to predict which patients are likely to get atrial fibrillation. From those 16 papers, we learned that you could create a good risk score by assigning 3 points to patients with heart failure, 2 points for valvular heart disease or coronary disease, and 1 point each for hypertension, diabetes, or male sex. In addition, age played a role. We assigned 0 points to patients under the age of 65, 1 point to patients between the ages of 65 and 75, and 2 points to patients over the age of 75. We then took this risk score and validated with 100,000 patient records at Intermountain Health. We learned that with a score of 1, the odds ratio of developing new atrial fibrillation was 3.05. With a score of 5 or greater, the odds ratio was 48. So how do these findings relate to clinical practice? Our risk score could be used by an internist or cardiologist to better determine which patients are at risk of AF. Knowing which patients are at risk could allow that internist or cardiologist to use long-term monitoring or other strategies to determine who actually has AFib, as well as the duration of the AFib. Knowing the duration and knowing if a patient has AFib has been shown to predict the risk of stroke. Those patients may benefit if they receive long-term anticoagulation or, in some selected cases, invasive therapies such as AF ablation or LAA closure. Future studies will help better determine how patients can benefit from this risk score. In particular, there are 2 observational studies currently ongoing looking at the use of long-term monitoring in determining the risk for AFib. Future studies may end up randomizing patients with high risk scores to monitoring or no monitoring to see if there's long-term benefit to those patients. There are 2 main takeaways from this paper. 1, physicians should determine how to better integrate this risk score with long-term monitoring into their practice. And 2, future studies are necessary to determine how to use risk scores in clinical practice. For more information, please check out the full publication. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.com. This video content is copyrighted by Mayo Foundation for Medical Education and Research.